Hello everyone. Today we will discuss the Papez circuit, a core limbic memory circuit and a high yield topic for FRCS neurosurgery, and particularly in relation to medial temporal surgery, third ventricle lesions, fornix injury, thalamic pathology, and memory disturbances. So this image shows a principal anatomical components of the circuit, the hippocampus, the fornix, and the mammillary bodies, then mammillothalamic tracts, anterior thalamic nucleus, and this is the cingulate gyrus, and this is cingulum, and this is entorhinal cortex and parahippocampal gyrus. These are here. Simple way to understand the Papez circuit is start from the hippocampus. The hippocampus lies in the medial temporal lobe. This, if we have removed that medial temporal lobe here, so this is in the medial temporal lobe, and it is critical for memory formation. From the hippocampus, fibers collect into the fimbria and then continues as a fornix. So here it forms like this. The fornix is a major efferent pathway from the hippocampus. It arches beneath the corpus callosum. So this is the corpus callosum, so it arches below the corpus callosum. So in this image we can see this is the body of the fornix and here is the crux of the fornix. Crux of the fornix is posteriorly, and now this fornix will project into the mammillary bodies. From mammillary bodies, the fiber ascend via the mammillothalamic tracts to the anterior thalamic nucleus. The tracts are small but clinically very important. Damage can cause significant memory impairment. The anterior thalamic nuclei then projects to the cingulate gyrus. Okay. The cingulate gyrus lies above the corpus callosum. Okay, this is corpus callosum, and the cingulate gyrus is just above this corpus callosum. It is a major limbic interface between memory, attention, motivation, and emotional behavior. From the cingulate gyrus, fibers pass through the cingulum and bundle towards the parahippocampal gyrus region into the entorhinal cortex. Entorhinal cortex then projects back into the hippocampus, completing the circuit. So now let us look at the surgical relevance. It will help us to remember also. First, the fornix. This is highly vulnerable during approaches to the lateral and third ventricle, especially when we are doing endoscopy, third ventriculostomy, or when we are moving some third ventricular tumor when we are going through the foramen mono approach. Bilateral fornix injury can produce severe anterograde amnesia. Second is the memory bodies. These are visible on the floor of third ventricle and are important landmarks in endoscopic third ventriculostomy. They are also involved in Wernicke's-Korsakoff syndrome, where memory body and thalamic injury contribute to profound memory impairment. The third is the anterior thalamic nucleus. It is infarction, tumor, surgical injury, or stimulation related effects in this region can affect memory and attention. It is also relevant in functional neurosurgery because anterior nucleus of thalamus stimulation is used in selected patients with refractory epilepsy. So the fourth is the cingulate gyrus and cingulum. This cingulum is a major white matter limbic tract lesion, and surgical disruption may affect attention, motivation, affect and aspects of memory integration. The anterior cingulate is also relevant in pain, emotion, and behavioral regulation. So for palliative pain management, which we do the lesioning in the cingulate gyrus. And in the medial temporal surgery during amygdalohippocystectomy or temporal tumor surgery, epilepsy surgery, or approaches around the emic cistern, the hippocampus, parahippocampus, and entorhinal cortex are directly relevant. Damage to dominant or bilateral medial temporal structures produce disabling memory deficits. And in examination sometimes it's asked that if it is asked what is the main output tract of the hippocampus, then answer would be fornix, hippocampal to fornix. And then where does the post commissural fornix project? It is in the memory bodies. So if asked what is the surgical risk of bilateral fornix injury, the answer would be severe anterograde amnesia. So that's our Papez circuit.